services?
Feeding therapy services can be hard to find. A lot of it depends on the type of specific therapy that is needed, whether it's an issue with muscle coordination, meaning the suck, swallow, or chew, swallow, breathe. If a child has a hard time moving food around and manipulating food in their mouth and then swallowing it safely, or maybe it's more of a sensory issue. A child has an issue with certain colors or textures, the way food feels in their mouth, or maybe it's particularly focused on behavioral issue and it's more anxiety. So depending on what the specific issue is, and there may be more than one issue, the child may have multiple things going on at one time. So that is going to be what guides where to find therapy and who to find therapy with. A speech language pathologist is going to help with muscle coordination. An occupational therapist is most likely going to help with sensory issues. A dietitian that's a feeding therapist, such as myself, will focus more on the behavioral issues. As a dietitian, I work a lot with occupational therapists that specialize in feeding so that we can work on expanding diet, dealing with the anxiety issue, while the occupational therapist may work on some of the sensory issues, like a child is not comfortable with the way a food feels in their mouth, for example. So how do you find those therapists? That can be quite difficult depending on the city that you live in. Certainly a pediatrician, a gastroenterologist may be a good place to start to help find those therapists. Part of it depends on what type of therapy you're interested in, and you can go to that particular organization's website to find therapists that are treated or that are trained in that specific type of therapy.